this is Kerry. Hi Kerry, how are you going?
Right.
That's good. And I'm Dr. Ingrid Tall. And today we're doing some Sculptra and also later some regen on Kerry. Now Kerry, what areas of concern do you have? What are you going to improve on your face?
The crow's feet around my eyes, some
Yes.
of the crepey skin and wrinkling that I'm noticing more than anything, I guess, and just freshening up
Freshening
my
up.
skin.
Good. Anything else more specific at all?
More specific.
If I gave you a
Plumping up
mirror.
a little bit would be great.
Plumping up? Good. Have a little look here. What do you mean by plumping up?
Okay, well, just my cheeks have dropped a little bit, so sort of like
Yes.
re-plumping them a little, and yeah, as I said, the area around my eyes in particular, yeah, just I guess trying to sort of reverse the aging process a little bit.
Good. Okay, so Kerry mentioned before the sagging of the cheeks, and Sculptra is really good to rebuild and volumize the cheeks. As we mature, the cheek fat pads sink down a little bit, and if we can build that up with Sculptra, it looks really lovely and freshens up the face. Also, often Sculptra is used to soften these nasolabial lines as well, and to do that really makes the face look quite a bit younger when you soften those nasolabial lines and bring them out. Also under here, the Mariette lines or contours, they can be softened by Sculptra too, and it's ideal for cheek rejuvenation, Sculptra. So around here, those cheek smile lines, the Sculptra actually softens those and thickens up the skin, even thickens up the skin to threefold as well. Alright, so you ready to rock and roll, Kerry?
Ready to go.
That's good. Let's wipe off that numbing cream. And if you relax your head back for me, Kerry. That's good. Now, Kerry's had the numbing cream on for about half an hour, so that'll have worked well. We're going to do some regen later, or platelet-rich plasma around the eyes for the thickening up the skin around the eyes, because you can't use Sculptra under the eyes or above on the eyelids. You do get some softening of the crow's feet with Sculptra. Big smile for me, Kerry. If you actually thread it along here, often these lines are improved down here, but not at the top and nor at the bottom here. So a combined approach is excellent. So I've just taken off Kerry's numbing cream. We've also got local anaesthetic in the Sculptra itself. Kerry's armed with a fantastically strong vibrator, and that takes her mind off it and occupies the nerve fibers, so they're thinking more about vibration rather than pain, and is really pretty effective for pain minimization. And I think we're ready to rock and roll. You all good? Oh, good on you, girl. Okay, I'll just draw it up. Okay, grab your vibrating thing and pop that on your chin here. That's good, nice and relaxed for me, Kerry. That's the way. Now, big breath in them. That's great, well done. And just push hard on that little funny vibrating thing just to take your mind off what I'm doing. That's excellent. Very good. Well done. Oh, she's doing really well. How's that feeling?
I can't even feel it.
Fantastic. That's really good. Now I like using a little bit of pressure. Kerry, if you just put a bit of pressure on there, I'm going to go and do the other side just to minimize the risk of bruising. Nice and firmly, and round we go to the other side. Right. Now getting ready to push with your vibrating thing. Well done. That's great. That's really good, Kerry. Excellent. Good. Now a little bit of pressure there, Kerry, as well. So you've got to be Henry the Octopus, please. That's great. Alright, now I'll take that back again. Thank you. And here we go again. Big breath in. Well done. Good stuff. And here we go. Big breath in. That's great. Good. Well done. Now, it does take quite a while for you to grow your own collagen, so it's not a quick fix, Sculptra. Generally, people need, a few treatments of it. Well done. That's good. significant risk with Sculptra is growing too much collagen. So if you grow too much collagen in one spot, you can develop nodules or lumps that you can feel in the skin, and that's not such a drama if you don't see them. However, if they grow too large and you can see them, then that's no good at all. So the way to minimize the risk of developing these collagen overgrowth kind of nodules is to massage for about 2 weeks after your Sculptra treatment, and do that twice a day for 5 minutes in the areas where the Sculptra is actually injected into the face. So that lowers the risk. In the bad old days, we used to use Sculptra in a lot more concentrated fashion and more superficially in the skin. So if you trawl through the internet, you'll see some horror stories about nodules in the past. But these days, everyone's using much more diluted concentration of Sculptra, and also in a different plane, which significantly lowers the risk of these nodules. Last little bit now on this side, big smile again, and relaxing and vibrating there. Here we go. Good. That's great. All done. There we are. Great. Well done. How did that feel?
That was fine.
That's
No
so
drama.
good. Excellent.
Do you swell because of the quantity that's being
Absolutely.
injected? Is that what it is?
Yes, we have like 18 mils of fluid being injected into your face. So what tends to happen then is that you look a little bit puffy for a couple of days, which actually is a really good look. People tend to look pretty, pretty youthful, having a kind of a rounder face. We tend to become gaunter in the face, and things drop, of course, as we get older. And if you revolumize, you look great for about 48 hours, then you tend to go back to exactly the way you looked before for probably about 6 weeks, and then you start subtly noticing some changes, but it's slow. It really takes like 6-9 months before you really reap the results of your Sculptra treatments, and it's slow. It's like watching grass grow, really. But then there's often an epiphany where a few months later you go, oh my gosh, that line's a lot smoother, and people start going, gee, you look relaxed, you look really well, and then you realise your Sculptra is really beginning to kick in. Any questions you'd like to ask at all, Kerry?
No.
No? Okay, now I'm going to do a little massage on Kerry, and spend a few minutes just massaging it all through, and then Kerry's going to do that tonight. It'll be a little more uncomfortable, Kerry, for you tonight, because the local anaesthetic will have worn off, and so you'll be a bit tender, but still the most important massage times are tonight, tomorrow morning, tomorrow night, the next few days, where you really need to work the Sculptra evenly throughout the skin, so it doesn't plump and increase your risk of nodules. Alrighty? Thank you very much, Kerry, for going on our website, and if you have any queries about Sculptra, don't hesitate to ring us.